What's up, fam? This is Dr. G. BeOrganic with Dr. G. I want to let everybody know that what we're doing today is we are going over two of the things that we talked about in the last video, kind of announcing about our event on March 12th. Stay tuned for that, where it's going to be really exciting. Make sure you get your spot. But today's video is going to be first and foremost about the difference between the high bar squat and low bar squat. Finally got something, thanks to Dr. Mo, to be able to show you the difference. We're going to do that real quick. And then I'm going to show you guys how to do a glute bridge. Now, one of the most important things for a reason why to do this glute bridge is when one of our patients actually asked for this it was a Sunday and their hip started hurting. Now, there's very specific things that are happening. And one of the things that are happening is a lot of times the glutes shut off, right? So the glutes are the big butt muscles, right? There's three different types of them, the glute max, med, and min. The max is one of the biggest parts of it, and it has such a crucial role. But when the hip flexors that attach to the lumbar spine and insert on the inside of the thigh are overworked, and we get this posture that's kind of hyperextended in the lower back and slouched in the front, we get this pouching in the stomach, we have this hip flexor is kind of pulling tight all the time, the glute shuts off, and then we end up walking around like giraffes. It looks really weird, but I guarantee you, if you watch a whole ton of people like walking down the street, you'll see it. It looks like they're walking almost as if they're sitting in a chair. If you walk by a mirror and you see yourself doing this, pay attention to these exercises, start doing them, go back and look at our Squats Bad for Back Pain video and start doing the functional squat that I teach you how to do in this. So again, a lot of times when we have this hip pain that starts maybe like high on the outside, or even coming into the front of the hip, sometimes going down the side of the leg, even sometimes we have this a pseudo sciatica. It's actually piriformis syndrome. True sciatica comes from the L5 disc pressing on the sciatic nerve, and that will send electrical like nerve pain from the lower back all the way down the leg, or it can go all the way down the leg into the heel and to the bottom of the foot. That's true sciatica though. A lot of the times it's not true sciatica. A lot of the times it's actually piriformis syndrome, where your pelvis and your sacrum is all locked up, which you need to be adjusted to help it work functionally. But when that locks up, the glute stops firing because the leg doesn't go straight back anymore. It goes out to the side and it opens up. And then you get this piriformis muscle that comes from the sacrum out to the outside of the hip that ends up grabbing, and it's a very small muscle, but in about 30% of the population, the sciatic nerve actually pierces through that muscle. And when that muscle gets overworked and tired, it grabs that nerve, and then you get that same pain that goes down the leg, and it can feel almost exactly, if not exactly, like sciatica. So first, let's go over the high bar squat versus low bar squat. Main difference between the two, obviously bar position, but high bar squat is going to be mostly to get the quads. It's very quad dominant. Your knees are going to go way in front of your ankle. So if I put this rod right where my ankle is and where my knee is, a high bar squat, you're going to go out here, right? You see how much bend is here, but there's not much bend here. It's all coming from the quad. Low bar squat, my knee is going to stay at my ankle. This is one of the biggest mistakes that people make, is when they're trying to do a low bar squat, they still let that knee go forward. We want it to stay here so that you're coming down like this. You see how my butt has to go back when we do that low bar squat. It's the same thing with a deadlift or the functional squat. We want the knees to stay over the ankle so that you can sit back like this, making sure that that hinge comes from here, not from the lower back. That's the other big mistake that people make. Make sure the hinge comes from the hip, back like this. Everything from here to here stays straight, core tight, chest open, glutes tight, hips tucked under, and you sit back like that. Now we're going to show you the bar position. High bar squat is going to be up here in the traps. Low bar squat is going to be down here in that posterior delt groove. That's going to sit in really nice. If you've got weight on the bar, it's going to slide down, and it's really going to lock in to the point where you can almost stay like this when you're doing these high bar squat. In the beginning, don't do that. Actually grab the bar, but you're going to be here. That low bar squat is going to look like this. Now it's a little harder because I don't have weight on to balance me, but I'm making sure the knees stay back, the hips go back first, and the head and shoulders are gonna come down like this. High bar squat, you're gonna be up here, and you're coming more this way. Now I have knee and ankle mobility issues, so that prevents me from doing a high bar squat. It makes it much harder for me. So if you have those issues and you've been dealing with, God, I can never do a traditional squat, which is usually people reference to as that high bar squat. If you've been dealing with that for a long time, try the low bar squat. Do some more research, watch this video, pay attention to all the little details, and try the low bar squat. You end up getting more of the hamstring and the glute with the low bar squat, as well as this posterior chain, and it helps everything to connect together. That's why that squat is so good for you. Let's go over to the glute bridge. So again, purpose of the glute bridge is to activate the glutes. We want to wake up the glutes, but also wake them up with the core and the glutes engaged as one. We have to teach the body how to work together. The only thing that connects our lower body to our upper body is our spine. The spine is only this big. It's only that big. So we need something that protects it, which is the core. The core is our body's built-in low back brace. Contracts all the way around, top and bottom. And when we contract that, it's one of the strongest things in our body to protect our lower back. So that is why when you have the core contracted and then you use those glutes to do everything from sit to stand, get up from a chair, you get out of a car, we do it all day, every day, even walking upstairs. We have to use the back of our legs. That's one of the biggest muscles in our body. We have to learn how to use them. When we don't use them, we lose them. That old saying, use it or lose it, is 100% real. We have to use it. So I'm gonna show you how to reactivate the glutes. Now make sure when you're doing this, you're paying attention to all the little details. I told another patient today, the devil is in the details, right? So we wanna make sure we're doing all the things right. You're gonna lay flat on your back. You're gonna come with your feet in a nice comfortable position. We're not way out here. We're not heel to butt. We're in kind of comfortable position. The feet are together. The knees are together, okay? Whenever you do these exercises, you break them down into stages. Stages that you can recreate every single time to make sure you hit all those points. So we're gonna break it down slow. First thing, heels, right? Toes come up. That engages the back of the legs, okay? Next thing, push the knees together. You're squeezing the knees together. That engages the inner thigh, the adductors. After that, we're gonna squeeze the core and pull it towards the spine. See how my stomach comes in? We're gonna pull that in. Next, you're gonna squeeze the glutes together and tilt the hips back a little bit to a neutral, not too extreme like that, and not where you're this way where you can fit that hand really far onto that back really easy. We want a neutral. So squeeze here, pull in, squeeze the glutes. Now that you have everything contracted, you're gonna lift the hips from here about 2 inches off the table. You're gonna come up like this and hold right there. Now the biggest mistake people make when they start doing this is they push the legs out. You're not visually gonna see a difference, but you will feel a difference from pushing the legs out that way, from the heels pushing versus pulling the heels this way. I can feel my glutes activate a lot more when I pull the heels towards me because I activate the back of the leg, the hamstring, and the glutes. When I push, I feel all quad. If you remember, the quads are already dominant. The hip flexors are already dominant. We gotta shut those off. We're trying to turn this back on back here. So again, we're gonna start toes up, knees together. You're squeezed there. Squeeze the core, pull the belly button toward the spine. Head, just keep it in a neutral position. Pull it towards the spine, tilt a little bit just to neutral, and come and pull and come up. And you're gonna hold there for about 5 to 10 seconds. When you start doing these, you're gonna do them not for reps. You're not trying to get strong. You're not trying to get big from this. You're trying to learn how to stabilize your body. You're trying to get the glutes and the core to work together. So you only do maybe 3 of these and you hold each one for 5 seconds, but you do it every day. You shouldn't be sore from doing this. You should feel your body starting to work better. You have to make sure that you get adjusted though. If you have this stuff coming up, it's a Sunday and you wake up and your hip is hurting because you took a long drive, your muscles have shut off, Your pelvis is locked up. This is to help you facilitate getting a little bit more functionality into those hips until you can get in and get adjusted. It's not a fix-all, end-all, be-all, but this is one of the most important things to help the body get back on track. Myself, Dr. Mo, Dr. Dave, all three of us have people work on this because it's one of the biggest things that we see come into the office, especially with lower back pain, is that the lumbar spine is hyperextended. It's diving way down towards the table when you're face down on my table and the hips are pitched up. That's what we're trying to work on. We're trying to get that to open back up, get the glutes to start firing so that the leg can go straight back instead of having these accessory muscles that are way overworked do all the work. Thank you again. I really appreciate you guys watching the videos, commenting, asking for everything. I love you guys. Stay tuned for what's coming. If you haven't watched already, I do have a channel on YouTube. It's BeOrganic, BeOrganic with W Dr G. That way, if you aren't on YouTube, or if you aren't on Facebook, you can find it on YouTube. All the videos are there. I put them in an exercise segment. Like it, subscribe it, follow it, whatever you need to, or follow it at the Joint Chiropractic Dr. Phillips. It's only on the Dr. Phillips page because this is for you guys, my family. Love you guys. You have a beautiful weekend. Thanks.